Welcome to StartUpHealth TV, where we celebrate the entrepreneurs and the innovators who are transforming health. I'm Logan Plaster, here with my guest, Farhaneh Ahmadi, the CEO and co-founder of Eddii. Farhaneh, great to see you.
Lovely to see you as well. It's a pleasure to be here.
It has been interesting to learn about your journey, learn how you have built this app that helps folks with type 1 diabetes. I understand it really came out of a personal journey, like so many founders in healthcare. I wonder if you can share a bit of that.
Yes, so as you know, I live with T1D myself. I've been living with it for over 10 years now. So it was definitely a very personal journey to me. It was actually at a very critical time when I was diagnosed. It was the first year of my PhD. I had so much going on, but I wasn't feeling great, and I had to deal with a lot. I felt lonely a lot of the times. When dealing with a lot of aspects of my type 1 diabetes, and I always wished that there were a character that I could talk to, something that would bring a little more delight into the day, and that is how the character Eddii and later on the company was formed.
Okay, so a character that brings a bit of delight, a bit of levity, so describe what that is in the app.
Absolutely. So on the outside, Eddii is a leaf. A character. It's very child-friendly, yet it's a very smart character. It responds to real-time glucose data.
Okay.
Right now we get that from Dexcom. And it's very dynamic, and over time it gets to know the user better. It asks the user how they're feeling multiple times a day.
Okay.
It links their blood sugar to how they're feeling. For example, it tries to identify whether that is because of their blood sugar or not. And we've built in so many other smart features into the app, whether it's a chatbot. Eddii talks to the user, tells them stories, plays games with them.
Okay.
And that way we make it more relatable and more enjoyable to manage your diabetes.
You're primarily targeting children, adolescents, or is this for anybody?
We primarily target children and their families. However, half of our users are currently adults. We are very excited, yet surprised by that, and we are looking to see whether we can launch a product for the adult population as well.
It doesn't shock me. You know, everybody wants something to be friendly and fun.
We are all big kids, right?
Yeah.
We want to play around and have fun all the time.
Yeah. What are some of the specific features that you're excited to share with patients?
So in addition to the gamification, we actually offer users real-life rewards, which we have coming very soon. So if you're into
Like
playing
what?
games, Roblox or Minecraft gift cards, you can win those on the Eddii platform, even Amazon gift cards. We will very soon be offering those. In addition to that, our chatbot will be launched in a few months. And most importantly, we have our virtual care. So that will provide the families with the support they need in case they would like to speak to a pediatric endocrinologist or a nurse practitioner on our platform.
Nice.
That will allow them to do it with a click of a button.
A platform that emphasizes this avatar that you can talk to, it really makes me think about advances in conversational AI and the way that we're starting to be, we're expecting a certain type of conversation, and it's becoming very normalized to have this sort of fluid, natural language conversation. How are the advances in generative conversational AI sort of propelling your industry and what you're doing?
Absolutely. So we're working on incorporating generative AI into Eddii's responses, but we have our own decision-making trees as well. We are using both, and in addition to that, we are using predictive analytics and pattern recognition from all the glucose data and the lifestyle data that we get from the patient all in one place. So the users will have a very enjoyable yet informative time chatting to Eddii.
Nice. Let's talk about traction, kind of how the market has responded. You all already mentioned that you're tied in with Dexcom, so you've got some good partnerships already going through the Dexcom CGM, I'm guessing.
Correct.
Other partnerships, other recent traction?
We are in conversation with multiple CGM and insulin pump companies.
Okay.
Also gaming companies. We now are licensed to distribute Roblox gift cards, for example, that we are very excited about. And so we're continuing those conversations. Ultimately, we'd like to have as many integrations on our platform as possible.
Okay. And what are you most excited about? What's coming next in the next maybe 3 to 6 months?
We are launching in Texas next week.
Okay.
We are very
What
excited about that.
What does that mean exactly, launching in Texas?
That means that people who live in Texas, families who live in Texas, can now download the app and use it.
Okay.
Everyone outside of Oklahoma and Texas will be able to sign up to our wait list, and we will give them access through our early access program. And so we're very excited about that. And in addition to that, we are also launching all of our new features and soon to be expanding nationwide.
Very nice. Oklahoma, then Texas. Are you taking a regional approach? Is that where the company's located? What's the idea there?
We have some operations set up in Oklahoma, but really the main reason for us focusing on these states is the rural population, their access to pediatric endocrinologists, and the care that we can provide them.
The need
through
is
our
high.
Virtual care, exactly.
Very interesting, very interesting. Well, Farhaneh, I appreciate the update. It's exciting to see that you're already achieving this traction. You're a member of our T1D broader community, and it's been great to see that collaboration and see that shared resources. So it's been exciting to see your progress.
Thank you. It was a pleasure to be here.
All right, keep up the great work.
Thanks.